Recent data from Israel's health ministry suggests Pfizer's COVID-19 vaccine is far less effective at preventing infection and symptomatic illness with the Delta variant than with previous strains of coronavirus, a finding that conflicts with other research indicating high levels of protection against the contagious variant as countries around the world struggle to contain new waves of infection. It is possible Israel's findings diverge from other studies in reflection of the fact they have had access to vaccines for longer than most other parts of the world. In other words, it is the most up-to-date and accurate assessment of the Pfizer shot against Delta. However, the Israel Health Ministry has not revealed the data behind their results, and there are a number of issues in the way the study appears to have been conducted that could create uncertainty. The study did not, for example, take the steps needed to rule out alternative explanations for the lower efficacy, such as bias in who is tested for COVID-19. Israel was an early leader in the global effort to vaccinate against COVID-19, moving swiftly to secure supply by paying above market price and offering to share medical data with Pfizer. It was a success, and the country dropped pandemic restrictions in May, though a resurgent wave of cases driven by Delta has put it on the brink of another lockdown. Israel is not the only country to struggle with new surges caused by Delta, which is more contagious than other variants circulating and possibly more dangerous, which has prompted new lockdowns around the world. The UK, which has one of the highest case rates in the world, almost all of which are caused by Delta, is an exception. High vaccination rates are helping contribute towards a possible decoupling between infection, severe illness and death, prompting the government to drop almost all social restrictions on July 19. In mid-July, Israel's health ministry greenlit booster shots, likely a third Pfizer shot, for immunocompromised people over concerns they could still be vulnerable to the disease. This includes some cancer patients, organ transplant recipients and people who are HIV positive. The U.S. Centers for Disease Control and Prevention is considering a similar move amid an ongoing debate over whether booster shots should be made available to everyone. 91%. That's how effective the Pfizer vaccine is at preventing serious illness and hospitalization caused by the Delta variant after 2 doses, according to the Israeli study. This is only slightly lower than against other variants. As this is the primary purpose of a vaccine, it is still highly successful, though it does mean it will likely not be sufficient to stop outbreaks on its own. The Delta variant appears to be at least moderately resistant to many of the vaccines in widespread use, especially after just one shot.